very much, Senators. I really am very much assisted in your responses, and it's clear that you have spent some time reading the report and reflecting deeply about it, as well as being in touch with colleagues and also people who work with the people from communities that you're part of in relation to the provision of social services through Tusla. And you've all expressed the commitment and the excellent work of the people out there throughout the country on the ground in the context of the organization. And I want to be very clear that I too want to express my gratitude and acknowledge the work that they are doing, and that it is a difficult time in light of the report coming out and the way in which it has been so critical of lots of aspects of the organization. So I am at one with you in that regard. And secondly, I'm also at one with, I think the board as well as the chief executive, who are in communication with those people as well and have expressed their I suppose, willingness to support them in a new way and to commit to that sense of urgency that you have all called for, I think, in different ways. So I just want to begin by first responding to your focus on the people who are providing the services and what we owe to them in terms of the way that they are working in the context of very difficult circumstances. That sense of urgency then, too, I think all of you spoke about that. May I address just a little bit, because I've certainly communicated that to both the chair and the chief executive directly, that I too would be looking for that. Of course, HIQA does. And in relation to that, the first recommendation, which is to develop an action plan, and that Tusla is responsible for that, to respond to all of the different aspects of the report itself. When I spoke with the chief executive this morning, he said that yes, they are working on that. When I meet the board at the end of this week, I think we'll discuss further that it looks like he said that it would take maybe a couple of weeks at max to put that together. And that action plan will have not only what's happening, but who's responsible, and then what the timelines and deadlines are in that regard. I think as well, HIQA have told Tusla that when they do that process of examining the recommendations and see how they respond in developing the action plan, that they've asked Tusla to revert back to HIQA, to revert back to themselves with that timeline in relation to the different actions. And I will ask HIQA to advise me on whether they think those timelines are suitable. So in terms of that sense of urgency and the action plan, I'm trying to say I think it'll be put together fairly quickly. It will identify who's responsible and who's accountable in terms of each actions, what the time frame is for that, and overall, I will ask HIQA to review that and to come back to me with a response in that regard. Secondly, in relation to, again, a sense of urgency and moving forward, in terms of the recommendation for the establishment of an oversight or quality assurance group that would ensure the implementation of the recommendations and a focus on that action plan. I think you're aware I appointed the independent Dr. Moline Ryan to chair that group. My officials have already met with him. They're going to meet with him again tomorrow. They're going through a process of agreeing the membership as well as terms of reference for that work. I think Dr. Ryan has probably by tomorrow will have read the report very thoroughly and to come forward with recommendations in terms of the type of members. It's not going to be a big, large group, and categories of membership, as well as I said, the terms of reference that they're focused on in order to do that work that is very much targeted at the actual recommendations. And my understanding is that they hope to have that completed, and also that we gather the people to do the work by next month, and then begin the work properly then in September. Having said that, we need to take a look at what's the ongoing time frame in that regard. But I certainly will get that, and certainly happy to come back to you in relation to it. I'm trying to describe, I think, the awareness of the need for the timelines in light of the sense of urgency. So the second arena, I think, that you've asked some questions around, of course, is the staffing and the human resource issues, which was a key aspect too of the criticism, the very significant criticism in relation to the HIQA report, as well as recommendations, I think, though, of moving forward. Like Senator Conway-Walsh asks the question, what is it like to be a social worker? Exactly, and that challenge and that difficulty and wanting effectively, yes, more colleagues to share the work. So I think that's a key aspect of it. There's a couple of different ways in which we're going to be approaching this in terms of that overall human resource issue. The first one of the ways has to do with the engagement with higher education, and this is a more medium to long-term approach in terms of the numbers that would be available to us that are actually professionally qualified as social workers that TUSLA can draw on. TUSLA has been liaising with the third-level institutions here and in Northern Ireland and the UK. We know there are a limited number of graduates per year, and there's significant contribution for them, so it's important that they liaise in other jurisdictions as well. But it may be of interest to note there has been ongoing interdepartmental work with the Department of Health, which has the lead role on the National Strategic Framework for Health and Social Care Workforce Planning. In addition, my department has also been working with members of Health and TUSLA in terms of taking a look at these various issues over a period of time. Having said that, we need to again increase the tempo in that regard. I myself already met with the Minister for Education last week to discuss this issue, and we agreed that his officials would work with my officials just to see where things are at, just in terms of not just additional places in terms of social work training, but also maybe to take a look at the types of courses, as well as other issues, or rather specific courses within the overall degree program. And other aspects of actually the higher education training for social workers that could lead to ultimately not just more, but also perhaps other people who are in as well, being trained as social care workers as well, to draw on those kinds of that expertise as well, that training, so that ultimately within the TUSLA agency itself, when they're focusing and looking more strategically on the staff mix, which was as well another recommendation of the report, and the sharing of staff with different types of skills and the workflow in that regard, so that all those practical issues in a large agency are going to be fed into, I think, the discussions in terms of with the Minister for Education and our officials, and looking at working with third level to see how we can be training more and differently. You also asked about, I think it was you, Senator Clifford Lee, about people coming from different backgrounds, diversity of backgrounds in terms of the training. Mature students are welcome to apply for social work training. They talked to me this morning when I met with the CEO and his COO about they do have, I think, I understand, they do have offers of bursaries as well in the context of training. They are conscious of and wanting to draw on people with different backgrounds. And as I've already said, we are looking, my own officials are engaged with the Department of Education in order to increase training places. There's two other aspects I want to just briefly in terms of human resources as well, is that perhaps more short to medium term, we need to do something before the medium term hits and we get more social workers attracted. And so I have said that we need that we should look for, and I will appoint an independent human resource expert to be part of Dr. Moline Ryan's group, and to work specifically on some immediate plans in terms of a different type of staff mix, and the workflow processes, so that social workers are able to focus more on the work that they do as social workers, as distinct from other aspects of the work that's necessary in working with our families and our children. In the other aspect, may I say too, would have to do with the retention of social workers, that obviously we need to bring them in, but we need to keep them. Senior practice social worker is going to be on every child protection team. Senior social workers are going to be deployed to all duty teams, and Tusla has a welfare strategy for social workers who experience stress. So I think all of these things have been identified of changes that would be required that would support our social workers who are there and want to stay there because of their great commitment and their sense of vocation in terms of what they're doing, as well as it being a profession. You had questions too around, and this is my second to the last points, the Garda, the relationship between the Garda and Tusla, out of which it arose. And a couple of things I just want to say there. They have, Tusla and the Guards on Garda Síochána have developed a draft memorandum of understanding on information and data protection issues. These have been some of the challenging aspects of working together that has slowed down some of the processes. We now have a draft memorandum of understanding in terms of the way they share their information. My understanding from my officials is that should be agreed finally within a short period of time in the next couple of weeks. It has been developed to ensure that there is no practical or legislative roadblock that impedes the sharing of child protection information between Guards and Tusla. There's no legal barrier to the sharing of that information for child protection purposes, and that's really important. You also, another aspect, and I think again, this was the question was raised in terms of the specialist interviewing with Gardaí and also Tusla, that on Garda Síochána and Tusla are looking at specialist training, getting additional specialist training to improve and working together, especially the Guards training Tusla, identifying more people who can do that in terms of that specialist interviewing with children. You also asked about and it was you, Senator Devine, the specialist child protection units that we have been working on quite a bit. In light of the Professor Shannon's report, and we are working with the Department of Justice and the Guards in developing a proposal, and I hope that it will be completed to the point that we can in the fall identify at least some form of piloting and approach to that, and that's what I'll say at the moment. But certainly there has been a lot of meetings and thinking and strategies developed with the Guards as well as with my own department. In addition, in terms of his report, the AGS has established 4 divisional protective units so far in 2018 in Cork and Louth, Blanchardstown and Clondalkin. So they are working with on Garda Síochána, Tusla is in assigning child protection social workers to work with each unit, and a further 8 units are expected to be open in the coming months. So I've tried to identify some of the key ways in which new actions which have been in the process of being designed are ready to or actually beginning to be delivered, which I think and I hope will make a significant difference. The final thing, and just as conclusion, is, and again, Senator Clifford Lee, you asked the question in terms of, who's responsible, and the questions of oversight and governance are absolutely critical, especially in the agency that protects our children. There is a board. There is also the chief executive. In appointing this oversight group, it will oversee and quality assure the implementations of this report, not the whole thing, but they will have some responsibility in terms of oversight ultimately in that regard. But ultimately, I'm responsible. Certainly, and I absolutely feel very aware of and committed to the implementation and to ensure that the recommendations of this report are implemented with a great sense of urgency, and that's why we've tried to act on some of them already. you know, but overall, it's my ministry. I know the chief executive has also acknowledged, I think it was at the committee, that he too is responsible, and at the level that one, as a chief executive within the organization, that he is, and he's taking that very seriously. And it's with that, with those different levels of accountability and oversight, as well as the changes that I'm indicating, and the ways in which we're going to implement the recommendations, I believe that this provides us with the opportunity to move into a new period for Tusla, and that, again, finally, the HIQA report does say that the vision is good, that the strategic policies at national level, which have been developing over the last years, are good, they're strong, but it's not enough, and that's what our work is for the next period of time. Thank you.
Thank you, Minister.